Hi. Yes, today I'm going to be doing a cranial nerve exam on you. Right. Okay, before I begin, may I have your name and date of birth just to make sure that I'm with the right patient? Okay. Perfect. I'm with the right person. Great. Well, my name is Nurse Bay. I will be doing this exam just to make sure that everything's okay. There's not a big concern, but it is good to do after having an accident like how you did, right? Just as a precaution. It can allow us to act in a way that can prevent anything more major from happening, right? Better safe than sorry. Okay, so I just want to start off by asking if you are able to smell okay. Do you have any strong senses of smell right now? Or are you reacting to anything in a more strong way? Okay. Okay. All right. Well, that's good. I am. And you, for instance, what does this room smell like to you right now? Just so I can make sure that we're on the same page. What kind of perfume do you think I'm wearing? You would be right. Okay, good, good. I happened to put some on actually a few minutes before I came in, right? Okay, good. And so, I guess, can you read the name on my pen if I hold it right here? Can you read that? I know it's a bit small, but okay, good. Good, good, good. So that's good. All right, and just so we make sure, can you cover your eye and tell me if that's still very clear? Okay, cover the other eye. All right, wonderful, wonderful. Okay, so now I'm just going to make sure, see how your eyes react to this. So I'm just going to good, good. Yes. Okay, so I want you to focus on my hand. Okay. Now I want you to do that with the other eye. Okay, just look at that. Okay, good, good, good. Okay, so this part I am going to just kind of gently touch just the side right here. I'm looking to make sure that your eye has a reaction, and I guess I wouldn't call it flinching, but your eye should always have an automatic reflex whenever anything gets near. I guess kind of like the, what's that? Like, I guess like the eye socket area. I should know these words. Yeah. Okay, so I'm just going to Okay, good, good, good. Okay. That's good. Okay, so now I'm just going to wipe my hand across your face, and I want you to tell me where I am touching you on your face. Just as a test of to see if you can have the same sensation. Yes. Okay, so close your eyes. Just close them. It's fine. Okay. All right. Okay, in what order did I just touch your face? Okay, good. All right, we're just going to do that a couple more times. And then just like how it was now, I'm going to ask you which order did I touch your face in, okay? Kind of like memory, if you remember playing that as a kid. Okay. Okay. Right. Okay, good. Okay. Wonderful. All right. Good, good, good. Okay. Let's see. So, this next one, I am going to see if you can feel it whenever I pinch you very gently. I'm just having to test and see your pain tolerance to see if you're still sensitive to things like pain or a kind of like a blunt touch, things like that, just to make sure that the nerves are doing what they're supposed to, letting you know when you're hurt. Exactly. And another thing is, I don't have it with me, but I might come back later and try this if the other test doesn't go as we want with the pain. We might want to try something with ice and see if that happens. Right. Yeah, just they didn't have any whenever I went down there. But with how everything's going right now, I don't know if that'll be entirely necessary. However, if the rest of the results don't come out how I want, I'm gonna go do that as soon as possible, just so we have that ruled out. Yeah. But so far so good. I'm not seeing anything that would make me concerned. All right, so let's continue with that. So I'm just going to just right on your arm here. Just gonna do that right here on your arm. Just that little fatty part. Yeah. Okay, so pinch. Okay, good. I'm just gonna do that a little bit more down there. Pinch. Okay. All right. Now can I grab like this, the very top part of your knee? Just the very top part. Yeah, the arm and the leg is what I need to check. Okay. Okay. Good, good, good. I don't think we might need that. Okay. Alright. So for the next one, just checking your notes there, we are going to do more with the light. But this time I'm gonna ask you just to follow it with both eyes, not like last time how I did it with one hand. I just want you to follow with both eyes. We want to make sure that everybody is working together. Yeah, okay. Good, 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 good. Right, that's wonderful, wonderful, wonderful. Perfect. Okay, good, good, good. Just taking a little bit more notes here. Okay. All right. So, can you smile for me? Just smile. Good, good. Now, can you raise your eyebrows as tall as you can? Okay, good, good, good. Good, good. Can you frown now? Okay, good, 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 good. Can you puff out your cheeks? Okay, good. Right, yeah. And can you close your eyes just really, really, really tight, just like you saw something you didn't like? Okay, good. Thank you. Okay, I guess, have you eaten anything since you would come here? Or before you would come here, but after getting hurt? Okay, all right. And is it something you had eaten before and you were familiar with the taste? Okay. And did you notice that it tasted different or anything like that? Or was there any sudden, like an increase in flavor that wasn't there before? Or was it the same as how it was it the same as how it had always been? Okay, good, good. Good, good. Okay, okay. So, all right, what I want you to do now is I want you to cover one of your ears and close your eyes, and I'm going to make a sound, and I want you to tell me on what sound that is coming from and which I am located. And you can say right or left, and I'll just assume that it's your right or your left, not mine. Okay? Okay, good. All right, so close your eyes. Okay, good. Now I would like that you cover your right ear. Okay. All right, so you cover your right ear, my left, your right, my left. All right, so what I want you to do is just cover that ear and tell me which way this is coming from. Tell me which way that's coming from. Tell me which way. Which way. Okay, which way is it coming from? Okay. Alright, so which other way is it coming from now? Perfect. Okay. Now, if I could just have you just walk from the door back and then back here. I just want to make sure that everything's walking okay. Okay, so whenever you want to. Okay, good. Okay, good. Okay, good. Wonderful, wonderful, wonderful. Yes, it's very dry in here sometimes. Okay, so we did that. And so, now, what I want you to do is just open your mouth. I want you to first say ah, and then I want you to try and yawn, because it is easier to do it with whenever I depress your tongue, you're going to want to yawn. And whenever you feel that coming on, just go ahead and yawn, because I want to make sure that everything reacts muscular wise and things like that in the back of the throat and stuff like that. Because if you have any difficulty swallowing, that's certainly a sign of potential problems that we'll want to address as soon as possible, because we do not want to let things like that continue. Yeah, okay, good. All right, so just go ahead and open and say, ah. Okay. All right. Okay, I'm gonna just depress a bit. Okay, good, good, good. All right, just gonna. Okay, you did swallow. Whenever you did that, you were able to yawn. Didn't notice anything. Not good. All right, and just really quick, I just want to make sure that you do you have a gag reflex normally? Okay, yeah, so what I'm going to do is, I promise to be gentle. I have to make sure that whenever you do that, that everything's functioning normally, because you might be able to swallow, but if something were to happen and you were to get sick and we don't know, and there was an issue with that, it is just, they're all connected. We should really just try it. Okay, I'll do this really quick. Okay, open up again. All right, just going to. Okay, good, good, good. Sorry about that. Not everybody's favorite part, including mine. I don't like having to do that. Okay, and so what I want you to do is I want you to swallow just and then speak. Just like how I did, just and then speak. Okay? Alright, good, good, good. Alright. Couple more things. Alright, and so I am going to press down on your shoulders, and I want you to press up, and I want you to try and move my hands, okay? And I'm gonna put resistance, so I'm not just gonna let you push me up. All right, just gonna. All right, is it okay if I press down now, or I can just whenever you? I'm just okay. What we're gonna do is I'm going to put my hands on your shoulders, and then whenever I feel you pushing up, I'm gonna push down. All right, good. All right, so. Right. Okay, good, good, good. Good, good, good. All right, and what I want you to do now is I'm going to place my hand right here on your face, and I want you to try and turn this side that I'm touching on, and I'm going to give resistance. I'm trying to see how strong the neck muscles are and making sure that they're good, they're not weakened by any damage to the nerves. Okay, good. Okay, so now I'm going to. Good, good, good. All right, the other side. All right, good deal. Okay, now this one is a little bit fun. It's the last one. I want you to stick out your tongue and then just move it from side to side. So just. Okay. Now try sticking it out, like straight out, like, I guess like if you were working out your tongue. Yeah, yeah, not so flat this time, but we want to make sure it's really nice, just to, you know, like I guess if your tongue had to stand up straight. Yeah, okay, so right out. Okay, great. Yeah, okay, so, I mean, eyes dilated perfectly, they both moved in unison, they were both moving together. You were able to tell whenever it was pinching you. You could tell whenever it was harder. You have not lost any sense of smell or taste. It seems as of now. You can hear okay. I don't see any type of facial, muscular, out of normal movements, and so I would say that everything here is perfectly fine. Yeah. Yeah. So I'm gonna let the doctor know that the cranial exam checked out and that we don't really need to do any more tests of that nature unless they feel that they're necessary. Well, in that case, I will see you later then. Okay, I'm gonna shut the door behind me now, all right? Okay, bye.